I really like talking to people, making them laugh. He put me one-on-one with the patient in a closed room.
There'll be laughing coming from that room. He'll be doing a Morpheus, and there's just laughter coming from the room. And if you've ever done a Morpheus not with Art, you probably were not laughing
That is
when
true.
you're doing it.
True.
So I don't know what magic you have. You don't have to tell.
Well, it's a combination of just joy and relaxing a patient. You just have to get it done. At the end of the day, you just have to get it done. I think that has helped a lot in my upbringing and stuff like that. And not taking no or halfway as an answer, as a solution to any problem. You just have to get it.
Welcome to Beauty Unveiled. I'm Dr. Angela Sturm, and today we have something very special for you. We are going to introduce you to my team. Hey, hi.
Hi.
I'ma kick back when you fake like that. Back when you fake like that.
So we've finally got Art Severand in front of the camera. And if you've been to our practice, you know he is our laser specialist. He is also my significant other of the past 10 years. Woo-hoo. Yes. We have 2 kids, and he has avoided two wonderful
kids,
vivacious children.
Yes. They both take after their mom.
and you in many ways, so it's nice.
Yes.
Blend. And you said you do our lasers, our non-surgical treatments. So tell everybody a little bit about how you got here, what you're doing beforehand, how we talked you into doing this.
Well, I don't know if we have enough time to tell the full story. However,
PG.
Yes. 10 year plus in orthopedics. Pandemic happened. We were there with the kids. It was one of those things that was getting a little tough for us once the clinic started going again as far as that. So it's kind of easier for us to bring me in to start doing lasers and stuff like that.
Because you're in ortho, and they're super busy. Like, your hours were like 6 to 6. They would say, oh, there's, whatever, basketball player wants to come in with their whole posse. Can you see them at 5 a.m? And he's like, yes. I'm like, no.
Yeah, true. That is true with that. It was difficult running crazy hours, and you're also doing your hours and having to pick up the kids with the daycares cutting their hours back. So.
Yeah, and they would call and say somebody was sick, and they'd call me in the OR, and they're like, can you come get them? And I'm like, no, you're going to have to call their dad, and then you had 10 more patients to see that they needed you to see before they left. And so I'm getting angry calls from the daycare, and then they cut their hours, and that was very difficult. So, and it was 2020, and I don't know if anybody knows, but 2020 was super busy for aesthetics and for plastic surgery. There was just, everyone was at home, you weren't going anywhere, and downtime was not even remotely a thing. It was before that you'd say 2 weeks of downtime, people were like, oh my gosh, I can't do that. After that, you're like, I've been home for months, you know.
That is true, which also helps us to grow our med spa and push it in the direction we wanted to go to.
So we were getting busier and busier, and we needed someone to help with the lasers, so sent you to school.
Went to school, got certified to do that. The rest is history. Here I am. Learned a lot from you as far as that, how to take care of patients and do it the Dr. Sturm way. So
it's the only way.
That's the only way. That is true. Yes.
Yeah. Great with patients, and could talk to a fence post, which is
that's
great.
true. That's true. Yeah.
It's always been nice for me because I'm more introverted, and I like talking with patients. I enjoy it. I do it all day. But if there's more than like 3 people in the room, I really go find a corner to stand in, and you can entertain the room, which is amazing. So
I really like talking to people, making them laugh, doing that. I'm nervous when it comes to speaking in front of big groups, but if you put me one-on-one with the patient in a closed room, there you go.
There'll be laughing coming from that room for sure.
Yes.
There's Morpheus. He'll be doing a Morpheus, and there's just laughter coming from the room. And if you've ever done a Morpheus not with Art, you probably were not laughing
that is
when
true.
you're doing
that is
it.
True.
So I don't know what magic you have. You don't have to tell, but
it's a combination of just joy and relaxing a patient, and Pronox helps. Getting them on the Pronox and getting them to their happy places. I like to call it.
So
on
tell them
level
what Pronox is.
Pronox is a combination of oxygen and nitrogen what they would use at
Nitrous.
the nitrous. Sorry,
It's like
what they
laughing
use-
gas.
Yeah, what they would use at the dentist, and so you just get in and relax, take some deep breaths, and just go at it. Tell a few jokes, and just relax.
Yeah. And they're in there giggling, having
Yes.
their treatment. And so it's
Yeah.
not hard to talk people into coming back to the next treatment,
That is
which
true.
sometimes is an issue with Morpheus.
Yeah, that is true. That is true.
So we were talking, I get you in front of the camera. So talking about what would be a good topic for us. And someone had asked me this question of like, oh, well, how do you have like the guts to do this or that or the other? And everyone always assumes, they'll say, oh, it's your family. My family's wonderful and they're definitely supportive. But it's the conversation you and I had is like having grit and coming from, places where we've come from, where people work really hard.
Right.
And that's just what you do. You work really hard and you put your head down and, so tell us about that.
Yeah, that's an interesting concept. I think for me, it's one of those things of looking at a situation of not a problem, but more of something's off, like it's just a disconnect, and looking at that and figuring out how can I connect it, how can I put the pieces together to make it whole again. So I really, really like that aspect of doing things, and it's just to your reference of being in the dirt or the grit, right? So it's, if you're out there, you just have to figure it out. So you can't really call on anyone. You just have to get it done. At the end of the day, you just have to get it done. So I think that has helped a lot in my upbringing and stuff like that. And just the know-how of just getting it done. And also too, I think what helps is working with surgeons, being an ortho my whole career pretty much, you just the knowledge of just getting it done and just making it happen. And not taking no or halfway as an answer, as a solution to any problem. You just have to get it.
Mm-hmm. So what was the biggest difference going from ortho to plastics?
I would say both of them are challenging in their own way. I would say with aesthetics, it's mostly, yes, the patients are there because they want to be here compared to someone's had a pretty significant injury. And so we have to want to get them back to health, and get them back going. But I think that's the difference of coming in, and I'm a person, I love to laugh, I love to joke around a lot. So that helps my mental as far as that, just because it's more of a fun environment, and it's relaxing for me to actually get in there, like you were mentioning about the Morpheus aid, and just laugh, just have fun. So it's, for me, that would be the big difference.
Easier to laugh with people that chose to be here.
Yes, it's easier to laugh with the people that's choosing me to inflict pain on them. So that's, yeah. So
Instead of the horse that kicked them, or
there you go.
whatever it
Or
was.
falling off the roof and the ladder and all that good stuff.
Yeah,
Like that, so.
yeah, it's fun. It's a fun thing we get to do.
Yeah, and also too, I would say that it's the instant gratification of, once we treat that patient, of knowing you can see a slightly difference within that 2 weeks or that 3 weeks, depending on what treatment we're doing, and knowing that they're excited about it and they're wanting to come back and they can't wait to get back on the table to do more and see what those results are going to look like after your 4 to 6 months, after their series is over.
Yeah, it's nice to see.
Yeah.
What's your favorite treatment that you do?
I'm going to say Morpheus. I really enjoy the Morpheus. I know that a lot of people, there's a lot of pain associated with Morpheus, and a lot of people are afraid of it. They've had some pretty bad experiences with it. But I like the Morpheus because it's one of those things to where I can, if a patient comes to me and they're talking about, well, I've had Morpheus before and it's an unpleasant treatment, that's that broken part where I get the joy in fixing that and then making that patient happy and excited about doing the Morpheus, and then we're able to get that non-surgical result from the Morpheus. So I really take pride in doing that. SkinPen is another one because you have to be very, very delicate with it when you're treating certain areas with the SkinPen. Any of those ones that are pretty tough that I can make it seem easy.
Yeah.
In my world, I really, really enjoy those. I think like some of the ones that are real simple, I kind of know myself to sleep when I'm doing them, but the delicate ones to where I can just do.
That's what the patient said. I think it was Monday that you had done her SkinPen before that. She was like, "Oh wow, that's that's a big difference from what I've had before. And she was telling her friends, oh, you know, if you've had it
Yeah.
somewhere else, no, you need to go, because it was light and it didn't feel, she said before, it was kind of uncomfortable because there was pressure. They pushed
yes.
down too hard instead of just painting it like
Yeah.
like a paintbrush, you know.
Yeah, and that's the thing, and that's one of the things coming to work for you, learning that delicate touch. You know, coming from orthopedic, you know, sometimes we can be a little rough, you know, especially when we're doing casting, bracing like that. But I think learning a lot from you and watching you work and watching how you do things and just being really delicate and the soft touch, you know, take pride in learning that from you, and I'm able to take that and apply it to a lot of the treatments that I do, which, you know, I don't know if I've ever said this, but thank you for
Well, you're welcome. How about that? We got it
Yeah.
on camera.
Oh, well, you know, yeah. Thank you for teaching me that, or allowing me to learn it from a distance. I would peek over your shoulder like, how is he doing it? There it is. Yeah. Thank you for that. I really appreciate it.
Yeah, of course. Skincare.
That'll be the last time I ever say thank
Yeah, I mean, I got it on camera. It doesn't matter.
you. Okay.
You never say it again. I got it.
Okay.
Any parting thoughts?
Well, I would just, again, you know, thank you with everything else that you've done. I'm just looking forward to growth in the next chapter and the next thing that we get ourselves into.
Yeah,
I'm ready to
exciting.
go. Yeah.
Well, thank you
Yes.
for doing this.
Well,
I appreciate it.
Thank you for having
Hope
me.
everyone enjoyed it. He will probably never do this again. So hopefully he will, but I get to tease him about it.
Yes. It was fun.
Yeah.
It was fun.
Awesome.
Well, thank you. Thank you for having me.
Yeah. And you can come see Art here at Aesthetic Specialist with us for all of your laser needs.
Yes. I'll promise we'll laugh and have a great time.